Let's turn to tonight's Get Real India story. In another setback, some would say, to the Aam Aadmi, hospital treatments are likely to get costlier. Because remember, earlier this week, the GST Council announced a 5% tax on hospital beds that could lead them to cost at least 5,000 rupees more. The decision is set to come into effect soon, and therefore we thought we'd go and find out what's the ground reality. Get Real India.
Get ready to shell out more for hospital treatment from July 18th. That is when the GST Council's decision to levy 5% tax on hospital beds that cost 5,000 or more will come into effect. This means beds that cost 5,000 rupees a day in rent will now be charged at 5,250 rupees. The decision to levy GST on hospital beds has drawn criticism. The Federation of Indian Chambers of Commerce and Industry has written to Finance Minister Nirmala Sitharaman seeking zero GST for healthcare services.
We need to understand that providing a room for a patient service is also part of healthcare service. So it is not different. So what the hospitals will be forced to do will be to transfer this increased 5% GST on the room rent to the patient, which unnecessarily will increase cost for the patient.
Hospital managements are warning of a domino effect in the days to come.
सबको पता है कि इंडिया में 62% लोग हैं आउट ऑफ पॉकेट एक्सपेंस करते हैं अपने इलाज के लिए, तो कहीं ना कहीं डायरेक्ट जो इसका बर्डन पड़ेगा वो मरीजों में पड़ेगा, स्पेशली मिडिल क्लास पे। इवन जो इंश्योरेंस कंपनी है इंडिया में कोविड के दौरान और कोविड के बाद या कोविड से पहले भी लगभग मैक्सिमम इंश्योरेंस कंपनी वो लॉस में चल रही थी, तो कहीं ना कहीं इंश्योरेंस कंपनी पे दबाव पड़ेगा। जो हॉस्पिटल्स हैं उनके लिए कॉम्प्लायंसेस बढ़ जाएंगे और कॉम्प्लायंसेस बढ़ने से उनका कॉम्प्लायंसेस बढ़ाने में करने में पूरा खर्चा बढ़ जाएगा, तो ये भी कहीं ना कहीं ठीक नहीं है।
The government, however, is not impressed by the arguments made by the healthcare industry.
I don't know whether there would be hospitals in smaller towns like Panipat, Karnal or Meerut where a hospital room would be costing 5,000 rupees or more. So if I can spend 5,000 rupees on a room, I can perhaps spend 250 rupees on a GST, and especially I can assure you that this GST which comes into a common pool will be used to also, not for everything, to also for the poor.
The government and the industry bodies are at loggerheads. They have claims and counterclaims. The amount, 250 rupees, is minuscule at the moment. But the Aam Aadmi will have to shell out more if a person is hospitalized for many days in one go. With camera person Sachin Chandok, this is AISHWARYA PALIWAL reporting for India Today.